So just as a reminder, hopefully you've heard a lot about Keen over the last year and a half, 2 years. And our goal is to be the go-to hub for practice-based and evidence generation, translation, and exchange in kinesiology. So when you're looking for information, the OKA wants to support you and make sure that you can find that information at your fingertips as quickly and easily as possible. Stuart, next slide. So in terms of some of the initiatives we've been working on this year, and broadly speaking, what we're trying to do is, from a strategic perspective, is increase the usefulness of Keen resources for our members. So again, when you get that yearly survey or annual survey, please provide feedback. It's really helpful. But on that note, one of the things we did this year is do some targeted outreach. So we reached out to members to try to understand how folks were using Keen, what you liked, what you didn't like. And our goal here was to make sure that, again, Keen is aligned with your needs. So we want to make sure that it's going to be a dynamic platform. We hope to continue to evolve the platform to help address all of the various needs that you have as members, whether it's educational or career and otherwise. Stuart, next slide. So in terms of the membership outreach, we were able to survey 48 members, and then we followed up with some deep dive interviews with 8 of those members. And those interviews were really helpful to understand how members were using the Keen portion of the website, what was found to be valuable, what some of the challenges were identified. And we took away some really interesting learnings. One was that, there's the best practice, there's the evidence piece. But what members really told us is that there were a lot of questions around the career and the progression of a career and how do I progress my career as a kinesiologist. There was also some questions around best practice guidelines and lots of comments about it was really useful to have the best practice guidelines and have the information presented and easily accessible. But there were questions about how to take that information and actually affect change. Like how do I, if I can paraphrase, how do I take that best practice guideline and maybe audit my own practice or maybe update my own practice to reflect those best practice guidelines? So that's certainly something we want to keep in mind as well. And then usability popped up. So there's a few usability specific considerations that we're looking to address with the web developer in the coming year. So on that note, what are we doing? One of the things I'm really excited to talk about or to sort of foreshadow today is the Kinversation podcast. So if you've been on Keen, you've probably seen a series of Kinversation videos, kind of 30-minute video recorded discussions, interviews. And what we'd like to do is convert that to a podcast format. And the nature of that podcast is going to be related to basically having conversations, developing content that addresses that career and knowledge gap. So this will provide us with an opportunity to chat with maybe kinesiologists that are new and emerging to understand some of the challenges they face, and also chat with some kinesiologists that have been in practice for a while, or maybe transition to a different branch of kinesiology or the like. So we're really excited, and we hope this podcast, which we're looking to launch early in 2021, will provide a valuable opportunity for all of us to contribute and share, but also to learn and listen to some of the stories and examples that can be provided from all of the wonderful work of the kinesiologists in Ontario. And then, as I mentioned, with website usability, we'll be doing quite a bit of revision. So working with our web provider in one touch. So we're just costing out some proposals now and hopefully continue to make that website easy to use and easy as your go-to hub for information. And we'll also to continue developing new best practice guidelines. And there's a lot of current work right now on ergonomics. The best practice guidelines have a number of great resources in the exercise and rehabilitation spaces, but we'd like to continue to build out offerings in the ergonomic space as well. Next slide, Stuart. We've also been working with respect to the network arm of Keen in trying to increase our network, both of employers interested in hiring kinesiologists and our network of students that are interested in the profession, and then facilitating internships so they can learn directly. That hands-on learning is the value sort of being in the profession and what sorts of things they can do to affect change. So with our Internship project, we've been trying to help employers understand the value of kinesiologists by encouraging them to provide internships. So we've been working very closely with students that have had internships, with employers that have sponsored internships, and with academic programs that have internships. And the OKA is trying to serve as the hub to connect all of these groups together and facilitate partnerships and engagement so that we can get more kinesiology students exposed to frontline practice, and also have more employers, test the waters of what it might be like to have a kinesiologist. So for some of you, you obviously would know the value, and maybe you want to take an intern to be that mentor and showcase a little bit more for those students what a day in the life of a kinesiologist can be. But we're also hoping to expand this to other employers that might not know the value of a kinesiologist, but might see an opportunity to kind of dip their toes in, so to speak, by having an intern to learn a little bit more about what a kinesiologist can do. And then maybe that, in turn, opens up some really great longer-term sustainable job opportunities. Stuart, next slide, please. So over the last year, we've worked, like I said, really closely with placement coordinators. We've worked closely with some healthcare providers. We've gathered some testimonials from students and employers. And we've learned a lot about what we can do as an organization to support these engagements. So in terms of demonstrating the value of student capabilities. So a lot of employers, particularly those that don't come from a kinesiology background, didn't quite know what to expect. They didn't know how a kinesiology student intern could help them. So a lot of what we're doing in our testimonials and case studies is providing this content, providing examples of, here's so-and-so kinesiology internship student, here's how they added value to the company, to the workplace that they were involved in, whether it's kind of corporate wellness or whatever it might be, or a clinic environment that hadn't been exposed to the services of kinesiologists. So we're really excited to do that. We've also identified a number of gaps in terms of the placement coordinators and their outreach capabilities. So the OKA hopes to continue leveraging its network to grow the number of internship opportunities that are out there. So we continue to work to develop some video resources, develop some case studies and other written documentation and content. And we'll be adding this to the network portion of the Keen Hub, again, to help grow and facilitate more internship engagement, not only by providing opportunities for kinesiologists like yourself to take on a kinesiology intern if you're so inclined, but also to expand the number of companies and organizations that are willing to take a chance on a kinesiology internship student, in hopes of opening up that broader market and helping more companies become aware, or workplaces or clinics become aware of the value of a kinesiologist. We've also been working, as you may know, our Keen project manager was a recent Guelph Humber grad, and each term, we actually take on as an organization 2 to 3 student interns, from, from different programs across Ontario. So thinking that we had a number of students helping us out with Keen and supporting Keen content development, we thought, man, what a great opportunity to let these students kind of share the OKA message with one another and to try to increase student engagement in the association. So our Keen coordinator and our student interns have been working to raise awareness of Keen and of the OKA amongst student communities and trying to increase our student numbers. And the hope there is that if we can get more students involved in the association, if we can get more students aware of what kinesiologists do and aware of what the incredible opportunities are for a kinesiologist, then we hope that as they get to that point of graduation, that we can start funneling more of those students towards kinesiology paths and really add to the, expand and add to the vibrant kinesiology profession. Next slide, Stuart. So over the last, over the last year, those student teams have worked with Armstrong Communications to develop a number of shareables. They've also developed a few short videos, and they've been liaising with each of the kinesiology student societies. So direct student to student communication. They came up with all of the marketing advertising on their own. Armstrong kind of helped jazz it up with some color schemes and whatnot. But really great to see the students that committed to sharing the benefits of kinesiology with their fellow students. Next slide. And what I'm happy to say is it's had a tremendous impact on our student engagement. So as of February 2021, so when we were initially starting this work, we had 91 student members. Now, as of August 21, we were up over 250. And Stuart can correct me if I'm wrong, but I think we're nearly 350, between 350 and 400 student members right now. So this targeted push has been incredible. We've seen a huge increase in our student membership, which we think is great because we're helping more students become exposed to kinesiology and all the opportunities and benefits that can be made available by pursuing a career in kinesiology. Next slide, Stuart. So the last slide for me before I turn over to John is just a kind of a quick update on the building out some of the network elements. In 2015, for those of you that were involved in the association, you might remember you may have participated in an interview and then a series of, in a focus group discussion as part of an education day. And then you may have worked in some online surveys and ultimately contributed to the research agenda. And one of the challenges that came out of the research agenda is that a lot of the questions that we asked as kinesiologists were very difficult for kind of the academic community to answer. So for example, what is the cost efficacy of a kinesiology-led treatment program for condition ABC, whatever that might be? And that type of information is really difficult to obtain. So what we're looking to do is create small groups, clusters of kinesiologists that work in a particular area of practice, let's say cardiac rehabilitation, just as an example. And we'd like to partner them with researchers that are also interested in, let's say cardiovascular rehabilitation as an example, and help develop and provide supports to allow the researcher community and the practitioner community to engage and share some information and share some data, and hopefully, lead us towards gathering the evidence that we need to make the compelling case about things like the cost effectiveness of kinesiology-led treatments. So looking for things like outcomes. What are patient outcomes? How do they change, from initiation to completion of a particular program of care? What is the typical range of costs that might take? So what is the cost dollar per unit of time or whatever the measure might be? And all of these bits and pieces of data are really critical, particularly, as John will mention, when we're advocating for the inclusion of kinesiologists in third-party payers, when we're advocating with the Ministry of Health and Long-Term Care. So having access to this data will be really helpful. So stay tuned in 2022. We'll be doing a lot more work trying to understand more about your practice, more about the outcomes that you track, more about opportunities to standardize some record keeping and some data across clusters of the profession, and potentially looking towards aggregating data so we can help make these really strong cases around, really strong evidence-based cases around the value of kinesiology. So really excited to continue that.